Hello, everybody. I would like to introduce myself. I'm Mauro Fradiani, and I'm coming from Italy. And I'm happy to introduce myself and to explain what will be the title of my presentation. And the title is The Importance of a Guided Treatment Plan for Successful Prosthetic Rehabilitation. And I'm happy to present this lecture to the Arab Dental Labor students. So let me introduce myself even better. I'm coming from Italy, I said, from this part of Italy. We are on the Adriatic Sea. Actually, the city is called Pesaro. It's close to Rimini, close to Bologna, just to let you know more or less where we are. And actually, we have a nice time, a nice spare time during summertime. Unfortunately, not now with the COVID-19. But anyway, summer was really nice. And even though we have tried to check everything to avoid any kind of problems with the COVID-19, that was the umbrella, the quantity umbrella that was present in our beaches at that time. So we have also a very nice countryside that can be visited. And again, what is important in a small city like that to have also a cultural event like the Rossini Opera Festival. As you know, Gioacchino Rossini is a very famous composer. That is, it was born here in Pesaro a long time ago, of course. So let me show where I am. And actually, that's in '91. I moved from another city, Ancona, to Pesaro, to this city. And that is the office that I, at that time, bought. Is an old palace, old building. And actually, that was my first office. But today, better to say, a few years ago, I decided to enlarge my office. So that's the original one with these windows there. And then I bought another apartment, the other building over there, extending and renovating. It was completely a wreckage, this apartment, actually. And I bought and rented again another building, the SEC Institute, that is the educational center that organizes all our courses, the courses of my colleagues. So now we have altogether 600 square meters. So let me show you, let me present to you the ACE Institute. Again, that is a nice atmosphere. You can see there is a main entrance. You see the break room where you have monitors everywhere to follow our lectures also when you take maybe a tea or a coffee just to rest for a few minutes. And actually that is more or less the ambient that we have created. This is the main room where we can have a seat for even 30 people. Sometimes we are reduced by the fact that we have also some booths that are organized for people that doesn't understand English or Italian, of course. So for foreign people that are coming from far, they don't speak our language or the English language. You can see that we have also a room for light treatment, of course, to do things over the shoulder. At least it was possible up to now, but today with light COVID-19, it'll be more complicated. And actually, we have also the room for the end-zone. End-zone are made on the upper step, on the upper floor. You go to the steps there. You arrive to this place where you can really enjoy to do all the end-zone courses that are a combination between, of course, theoretical part and end-zone and light treatment on patients. And then you can work on models to mimic what we do on preparation, on impressions, on all the steps on pros, cementation, etc., etc. Then, especially on the summertime, we have the time also to enjoy going to the beach, maybe with our parents, with our friends, etc., etc. So let me show you a short movie presenting our office. This is the office. We have the office close, of course, to the educational center. In no way it's easy to go to move from one side to the other side. On the other hand, it would be very complicated if your patient asking for you, you may be at the other side. So the very tough life, you can say, tough life, the right word. People coming from all around the world all the time. We do, again, we have also tutors. Today with my associated, we can organize many courses. You can see the offer in the Ferdinand Education website, of course. And again, my team is formed by myself, of course, but together with me, we have also Leonardo Baccarini, Tiziano Bombardelli, Stefano Gori, and Roberto Torini. They are really very busy with me to organize courses, to really speak with lecturing around the world all the time. So it will be very tough period for us. Even though this period of time, of course, we have to just speak with other students around the world through the internet. But as soon as we have the chance to create better kind of atmosphere around the world, we will move and we will come to all the people that are asking us to come. So hopefully quite soon. So what is the main goal of Ferdinand Education? The main goal is to really have courses, conferences around the world, as I said, today in the web. But one of the most important steps that we have obtained and built up the last years is the multimedia app that is guiding the clinician in the prosthetic treatment plan. More than that, we have also tried to finalize a new book that will be on the minimal invasive prosthetic procedure, and that will be hopefully already not so far. So let me start with the presentation that is related to the treatment plan on extensive rehabilitation. Of course, we start with basics, but we have to follow a kind of systematic clinical approach. So the case examination starts with dental team, with the patient and the lab team all together. So we cannot have one of these teams that not working well with you and not collaborating in a proper way. That is absolutely important to create a good diagnosis. Only if you have a nice diagnosis, you can have the nice and appropriate treatment plan. At this point, having also the chance to understand what are the goals and what are the modalities to achieve this result. So aims and methods, we can preview today most of the time. You can have a real or virtual images. So real, when you can do like the mock-up. Mock-up can be a nice way to communicate with your patient, of course. Virtual on the computer. Both are okay, but of course, the real one is even more impressive for the patient, of course. The mock-up can be direct, indirect, as you know, but of course, it can be done only if you have to add volume on the initial case. So it can be maybe nice, can be probably needed for the extensive rehabilitation, not needed maybe, and not possible for maybe more cases in which you cannot do so much. So what you have to talk to the patient. What are the objective possibilities? What are the risks? What is the time needed to finalize this kind of final solution that you propose to the patient? Of course, you have to understand, you can create an ideal road, an ideal treatment plan, but having the chance also to explain what are the procedural sequence and the costs versus benefits. But at the same time, you can also have the chance to talk to the patient and say, okay, that's are the alternatives. You cannot afford this treatment, it's too costly, too expensive for you, or too difficult to stay too many hours on the chair. Okay, you can have some alternatives. But remember, when you start to do starting to do provisional, you can decide yourself to put a provisional in place without having any really final idea of what you have to do. Remember that is irreversible steps. When you cut the teeth, grind the teeth, put a provisional, you have started anyway, a kind of therapy. You have to, of course, finalize it in some way. So when you finalize your restoration, especially if you do everything well, you have to, at the end of the treatment, have the chance to say to the patient, you have to come back to me every few months, 3, 4, 5, 6, depending on the case, of course. For the maintenance, that is absolutely important to have a good prognosis. You cannot have good prognosis on what you do if you have no good maintenance. And then you have to let them sign the informed consent. And now, just now, only now, you can start with the procedural phase. Procedural phase starts with the thinking process. So you have to think about what to do. So we have not to do mechanically what you do. We don't have to do mechanically our treatment plan, our daily work. The thinking process should come in advance, of course. And when you look at a case like this, you have to understand that always you have the chance to really see that we not just an aesthetic or just a functional problem. It's always a combination. It's always a balance between both aesthetics and function. Only with that you can formulate the appropriate diagnosis and to formulate the proper treatment plan, having the chance also to explain to the patient all the clinical steps. So let me understand. Let me explain what is exactly what you do. In extensive rehabilitation cases, I will start always with the aesthetic and functional analysis. That is before starting to grind teeth. You have to think about it, to really see what are the aesthetic situation, the functional situation, and how you should modify this initial situation. And that you communicate this with the lab to do the workup. One of the major problems is that most of the dentists around the world just say to the dental technician, please do the workup, without saying anything more. So you should say, do the workup, changing these, aesthetically and functionally. That's the only way to have the appropriate workup, that really describing exactly what you want to change in this case. But most of the people just say, do the workup, believing that dental technicians are kind of magician. Never works like that. You have to communicate exactly what you are, the change that you have to really put in the new work that you are doing. And once you do the mock-up, the workup, of course, you can do the mock-up, derived from the workup. And then you can do the provisional. And then you can appreciate with your modification, you achieve a good aesthetic and functional integration. And only of that, we can also have the chance to achieve a good biological integration. So in the case you have the chance to do implant surgery or periodontal surgery or orthodontics, you have to wait more to also have the third part of your treatment plan done in the proper way, the biological integration. That is valid, of course, on teeth and on implant. And what is very important now, once in the new provisional, you have already inside the provisional, all the three components perfectly integrated, so aesthetics, function, and biology. When you have that, all three together, that's the right moment to say, I want to copy it. So from provisional to final restoration is the very important step that you have to really achieve. Then, of course, the second part of our rehabilitation will be nicer in terms of you can play with the ceramic work. We like it. We love it. Okay? So we have to talk about implants and aesthetics. You can have the chance to have a lot of different kind of solutions in terms of ceramic work. You can have veneers, you can have full veneers, you can have buccal or occlusal veneers, you can have overlays, inlay, onlay, you can have a crown and bridges. So in one word, what we say, what you call today, a minimal invasive prosthetic procedure technique that will be really the main core of our extensive rehabilitation. But to achieve this kind of successful result, you needed to be guided in your treatment plan formulation. Is something that has to be understood. So of course, then you have to have an effective communication with the whole dental team, like orthodontists, implantologists. It is sure that you have to effectively communicate with the patient, explaining him or her what you want to do. It is clear that you have an effective communication with the lab in analog or digital way for the WhatsApp, of course, we need also this. And of course, it's important to understand also that you have a possible integration with other digital workflow system. If you have the chance to create the first step in red, or I mean, a guided treatment plan formulation. So how can be guided in my treatment plan? That is the main point of this point. And the main point is that I needed the data collection. The data collection are absolutely needed to have the treatment plan formulation, finally. I've published these two books, volume 1, volume 2, in 204, volume 1, on 207, volume 2, so a long time ago. You have 12 editions, so were translated in 12 different languages. And of course, I have done this work in a long time. It took a long time to do it, but what is important, at that time, so 16 years ago, I was able to create a kind of chart, an aesthetic analysis chart, in which I could put all my parameters on aesthetics, and guiding the clinician in order to be able then, with the traditional way, with the paper, okay, like here, to have a laboratory chart that was a kind of chart that was added, in this case, on the second volume, with the clinical, going back one, with the aesthetic analysis was done on the cartel aesthetic checklist, that was, again, joined together with the first volume, so was added on the first volume. Instead of the second one, the laboratory chart was added on the second volume, 207, okay? So lab chart is everything that we have seen on the aesthetic checklist before, and now we have added also the functional information, and altogether we can give to dental technician all the info that he needed to really build up a perfect work. That is considered tradition. Why? Because it was made already more than 15 years ago, and because that was done on a piece of paper that you have to sign some notes and some cross in order to really understand what we want to communicate to the lab. But now that is something that is no more maybe needed if you have the chance to use a really guided treatment plan. And the thinking process, again, starts there. We can compare analog versus digital. And today, even in 2D system, we have created something new. The digital treatment plan is because in 2D, we have created this kind of app. This app is able to collect data, completely data, and to have the chance to formulate a treatment plan. That is great, especially in extensive rehabilitation. So main steps are the following. This is, again, an easy tool to guide the clinician to the formulation of the treatment plan. It's a kind of systematic approach on prosthetic rehabilitation, what we have teach for a long time at this point. So the features and benefits. First of all, is a guided treatment plan formulation. You can communicate with the lab in an analogic or digital way. You can communicate with the dental team, like the implantologist, the orthodontist, the other specialists, and communicate with the patient that will be really surprised to see how you really guide the treatment plan in a proper way through this app. It's completely new for them to use an app to do a treatment plan like that. And of course, the possible integration with the other digital workflow system. So the data collection, again, let me show. We start with the guided photography. Actually, we start first of all with the name of the patient. Let me give an example. When you have to talk about the initial treatment plan of our cases, we start with incisal edge position. That will be the starting point of our rehabilitation all the time. When you do implants, when you do your natural dentition work, the same. So we start with that. So once you have the chance to say the tooth exposure at rest is minimal but present in the middle picture, as you can see, like 1 millimeter, 1.5, 2 millimeter of exposure That is interesting because at rest position, a young lady show probably 2 millimeters, 3 millimeters. A man 1 millimeter less, but an age, an aged man, an aged woman on the 60, on the 70, when you treat this kind of patient, they don't show anymore any incisal edge at rest. So that is a starting point of our evaluation, a starting point of our fixing, how to fix our final work, starting from the right point. From the right point means from the incisal edge position. So why I'm saying that? Because when you start to say, I'm treating this lady that is 25 years old, it is female, I expect to have as final point, final step, to be 2 or 3.5 millimeters of exposure. But if I have in front of me a patient that is a man, it is old, like 70 years old, you can have the chance to say that he has underneath the lip, and you cannot see everything, he is like 2-3 millimeters underneath. So to restore this patient, we need to start exactly to redefine this incisal position. It's a long story that I want to shorten it, that is not easy actually, because it means that you have to understand many other parameters of aesthetic analysis. But starting from that, you can say that if you write the name of the lady, like Cinzia, is 25, my target, final target, will be to have this incisal position that will be showing 3 millimeters of to exposure at rest, instead of having maybe 1 millimeter of the old man. So we are 2 millimeters different. So when you write down your name and your age on the first page, on the first screenshot of the app, you can immediately realize that the target is different. And with the target different, all the system, all the app work in different way. So we start with the man and the woman, sex and the age. Sex and age of the patient is absolutely important because at the first screenshot, you have the name and the age of the patient, and we put it inside the system gives to you the final target that is different from each patient. And that is made automatically by the app, not by you. So just the right name, you already have this information. We have, of course, the chance to also put all the video inside, the video full smile, the S-sound, F-sound, the phonetic test, etc., etc. Of course, I cannot explain completely this kind of app 100%, just to explain to you some of the steps. And going back once, I want to just send to you also this information. You see, you have some mask in this middle and the right picture. You have the mask frontally, we have the mask laterally from the profile. Why this? Because we have in this particular case a kind of ideal profile, ideal veil of the patient. And in this case, we have a kind of mask that guide you also from the distance, that you have to use your iPad. Yeah, because you're working only with the iPad at this point, okay? And that is a perfect way not to have a distortion of the face. So the distance is already created. We have also two levels, as you know, as you see, vertical and horizontal level, to really create the perfect picture of the patient. And that will be then recreated each time that you take a picture, in the frontal and lateral view. We said movie instead of picture. No, we say movie and picture. Of course, the picture is a static moment of a dynamic action. So the movie is representing even better what you want to see, what you want to check on the patient. Want to check many of these steps. I cannot show you everything that is present in the app, but for example, smile line, labial corridor, inter-incisal line evaluation are 3 examples of some of the parameters that are objective parameters that you can really guide the patient on this kind of situation. But the app will guide you actually in what you have to find, in what you want to analyze without losing any kind of steps. Not just aesthetic, but also function. Of course, the causal relationship will be absolutely very important. Unfortunately, today, everybody talking just about the aesthetics, but believe me, all the time it needed to have combined with the function, of course, so we can have the chance to understand this kind of overbite, overjet value, to have the nice range to create no problem on the patient. So that's just a little example. Other example is that you can work on the upper and lower anterior teeth to see in kind of a rendering procedure that we will see in a while, what will be the nice way to work with. So actually, we have the chance also to understand that we have the color of the abutment, the color of the teeth. Of course, you have a lot of information about everything. Just to have a little summary of what we do. But the end of this kind of work is that to achieve this result, to say to our technician how much you have to elongate or shorten the teeth, how much you have to put outside or inside these teeth. So that's valid for the upper, for the lower. It's not just related to the 6 upper anterior. We know that we have an incredible success of the digital smile design, for example, that is a great tool, but that is much more complete, actually. There's nothing to do with that. It's not a show content, is like a very solid content inside that is absolutely needed to create a very nice treatment plan formulation. Just to show you a kind of rendering procedure, you see upper 11, lower 41, that's the 2 teeth that are considered now. And we have all the green numbers. Green numbers means that all the values are within the normal way that you can find in this case. So actually, we have the chance to move it. Let me show you. You can press the button on the upper arch in red right now. You see upper, and you see lengthening. You see that you can see the lengthening procedure. You see also the number changing on the left side in red and in red and in orange. Then you can, the incisal buccal lingual displacement, this point can improve. You can see the quantity of overjet and overbite. Having more buccally will be more overjet. Plus, you have to touch this red button on the upper part of the iPad. You will see there is a red button. You can have a kind of explanation of what you have seen in this screenshot. So every screenshot have an history behind, have the explanation, like the functional aspects. In this way, the video alteration, and then of course everything that are related to the video alteration, all the value that you have to check it. If you treat the 1 arch, 2 arches, upper or lower, you see that is a kind of an e-book behind. That is a kind of e-book that is ideal to really understand what you say. That's if you push the red button over there. Then you have also this kind of solution. If you touch the question mark over there, you see it on the red arrow, you have the chance to understand what you need to know about the old button that you can press. You press this button and you will have this. So use this button to carry out all the desired modification. Every change will automatically influence the overbite and overjet. So you know what you're doing. So it's very, very complete. That's what I said. And then also, of course, we have the chance to see, for example, changing the length here. The overbite are changing on the moving this teeth. And actually, also look in the video. When you want to increase the video, you see this is the occlusion that you can see here. You have overbite 4.8, very, very deep. Overjet 1.6, 1.8. So now you have to increase 3 millimeter you have to increase 3 millimeter the vertical dimension, like that. You see now the upper and lower teeth, they are separating more and more. Now, we need to increase the video for prosthetic reason, because maybe you have a lot of wear on your teeth. Automatically, you have this distance that has to be closed, to be fixed. So we need the contact between upper and lower. So what is the way? We can lengthen the teeth, for example. Now you see, lower, the arrows, lengthening. Look, you see contemporarily, you have a move on the lower 41 on the left side. The length was 7 point something. Now we have increased the length. We can arrive up to some value, but then you are stopped. Once you arrive to 8.6, 8.7, 8.8, stop it, because then it become a red, become a wrong one, a dangerous value. It means that it's too long. But at this point, you are not still arrived to the lingual, or better to say, the palatal part of the upper teeth. So now you go to the upper, and you go to the palatal thickening that we see now. Plus, you see on the rendering coming back until they touch. You have a possible contact there. So that is the way how you can simulate what you need to achieve as final result. Okay? That's for video alteration. That's, I believe, that is interesting, really. So in GetUp, you can have all these kind of solutions. And again, I believe that is really important, again, to have an ebook behind. So in each screenshot, you can find the way how to really know about the topic. You can also have all the picture in a way, going back to the initial picture. So just touching the button there. And again, you have also the alert. There are many alerts if you are going out of the normal road that is colored by the green color. But if you have orange, it's still compromised. If you got red, it will be absolutely wrong. You have to stop it. The alert, there are around 100 alerts potentially if you are wrong, and they stopped you on the way you're doing. So it's important also to understand that you can have the chance also to have write some notes, and then again have the scroll and going to each chapter of this kind of GetUp value. So you have all the title of your topics: upper central incisor dimension, lower central dimension, select reference tooth, labial corridor. So each one of them, you just have the scroll, and you will go up and down where you want, the topic you want to achieve. And then the question mark that you have seen before, the question mark that is needed in this case to let you know what you have to do when you press the button, what happened. Okay, so let me go ahead. Once you have collected all this data, you have full of information there, maybe for the first time you are able to send to your colleagues, maybe orthodontists, maybe implantologists, or better to say, to you dental technician, all the information, starting from the beginning to the end, all the picture, all the movie, all the evaluation that we made, all the aesthetic evaluation, all the parameters, all the occlusal parameters, all the functional evaluation, what kind of material you use for the final work, what kind of a color that you have underneath, how much you have to increase to the length or to decrease the length, etc., etc. So all this information, you can find it in www.getupfradiani.com. If you go there, you can have directly information. You can find, of course, also put in Fradiani app, but better directly to www.getupfradiani.com. So let me show you a case that we have done in this way. And in the daily practice, we treated this patient. This patient, as you could see from this smile, was not really perfect smile. Short teeth, yellow teeth, and big wear on the upper and the lower arch. So we did all the picture in the proper way. And of course, we have done the facial analysis, being guided by GetUp with the horizontal vertical reference line. As you could see here, we have tried to, first of all, orientate the rehabilitation in the proper way, according to the parallelism between the orientation of the occlusal plane and the horizon. You see that the patient have no exposure at rest. So this is a classic case in which a young woman target to the final GetUp value will be around 3.5 millimeters. Around 3 millimeters, more or less. She's showing nothing. So that's the starting point of our treatment plan, as I said before. So we sign it, automatically the app gives us the right number to do it, according also to the perfect ratio, that is 80%. It means the width of the central incisor should be more or less 80% of the length. So length is 11, width should be 9, just to give an example. And then you can trace the incisal edge evaluation, incisal edge curvature, Of course, you have to also define the horizontally the incisal edge, also laterally from the profile. And when you have all the data that are collected, you can process the value, of course. So our question was, in this case, do we need to lengthen the uppers? How much and where? Do we need to lengthen the lowers? How much and where? Do you need to increase the video? How much and where? Today, of course, the increase of video is quite usual for us, especially on the worn dentition, because we don't want to destroy even more the teeth that are already worn out. We want to increase the video to avoid any kind of tooth preparation, especially occlusally. So all the questions are asking to you. You are the clinician, of course, you still have the power to decide yourself and to know what you want to achieve. But of course, you'll be very, very much guided by the app. So you see here, this lady was showing on the upper nothing. Go to the left picture, and you see exposed at rest was -2 millimeters. It means the incisal edge was not at the level of the upper lip, was underneath, was covered of a couple of millimeters. And when you increase the length of the teeth, you have to consider that to achieve at least the visibility of the upper teeth, you have to increase at minimum, at least 2 millimeters, plus some additional value in order to see the teeth. In this case, we have the upper, the lower arch that with the tooth exposed at rest. That is one of the parameters. Other parameter, lengthening. Yes, you have to lengthen cervically or incisally. Other evaluation that should be clinically done with the help of the get-up. And again, what should be the incisal edge in the back lingual position? Should be actually visible. How much should go more out or more in? Other questions. So at the beginning, the patient had 7.9 length, 8.7 width, a -1 of exposure. So it was 109 of proportion instead of 80, that is the ideal. So it was larger than longer. So automatically, the app gives to you 10.7 of new length, that is the proposal for our app, and 1.8 for the tooth exposed at rest. So finally, we could see the teeth at rest, increasing the length and arriving to 10.7 length. So you see that 10.7 was the goal. And you see that after having done the mock-up, we came from 7.94 to 10.69. So we said 10.7 exactly. Is identical practically. So that's the mock-up. The mock-up had to be judged, had to be controlled. It had to be then defined if you want to follow or not. So other question for treatment pre-formulation, do you need to treat also the lower tooth? Of course, yes. And what we increase, how much we increase, how much, where, upper, lower. So that many questions that have to be answered, just having start to explain exactly all the functional and aesthetic parameters. Takes days to really stay together and to really understand all these steps. So again, we discussed even before, we have increased the length also of the cuspids, as you see, to 13 and 23, and then all the other part. So at this point, we have selected all the steps to arrive to the final outcome. It means how much you have to increase the length, how much you have to increase the backer position, the lingual position, the video, all the steps that you need in pros, practically. And as you have seen already, you show again what will be really the nice thing to follow. You can the rendering procedure, a rendering way to show exactly what happened and what you would like to achieve as final result. Actually, that is the suggestion of the app. It means that the value that you see in green is what the app found for you. But of course, you can customize as you're doing right now with the rendering. You are lengthening, you're shortening. You try to see on this way what will be their nice final outcome for you, for your taste, for the patient needs. At this point, you decided maybe to keep it like I did in this case. I kept 100% of what the app gave to me as information. But again, we want also to amplify our knowledge and to really check what there is behind in this kind of ebook, as I said already. That is really some unique, tool that gives to you this kind of information. So finally, we have all the information needed. So we also have decided what kind of ceramic work you have to do, like buccal veneer, buccal or crucial veneer, full veneer, overlay, tabletop. You can see also these kind of solutions represented there on the upper, on the lower, on both. And finally, we can do a PDF. And for the first time in their life, the technician can really communicate with you. So the communication with the laboratory by our side, with the dental team, with the ortho, with the implantologist, will be just great. And again, that is the way how to do it. And I really believe that this kind of information are really needed to be sure that we have not missed any parameter, and to be sure that we have analyzed all the aesthetic and all the functional parameters before deciding what to do in the workshop. Remember, workshop is representative of your treatment plan that you have in your mind. It's not something that is done in a proper way, just giving the chance to the technician to invent something. They're great, great guys, great technician, but not magician, never. Remember that. So then you can go ahead, analog way, with the classic traditional Facebook, or with the full digital way, like you see here. So I believe that this is also the chance to work as you like it. We have the digital articulator, of course, but you are just giving them all the information about how to create this digital WhatsApp, having be guided by the numbers that you have found here. You see the get up numbers to increase the length, etc. That's positioned in the WhatsApp of the technician that can really guide and finalize it in a perfect way. So this length that you see here from this lady, the lady that was treated in this case, so the need of increasing length on the upper and the lower was starting from the numbers of the get up. And actually, that is something that now positioned in the anterior area before doing the entire workshop. Because remember, the first part of our treatment plan starts always from the definition, from the frontal lateral view of the incisal edge position. Incisal edge of the upper, incisal edge of the lower. So when you give this information for the workshop to our technician, please remember to send them the incisal edge position of the lower and the upper teeth. Then the orientation fusion plans that are absolutely important to be needed, to be created. The video determination, so how much you want do you want to modify the video? What about the occlusal posterior stability that are created, having more space occlusally through the increase of video? You can optimize and stabilize your occlusion in centric relation position and give the chance to our patient to have the anterior guidance finalization. All these are indications for our dental technician. I cannot say that they have to, they must do it. I prefer to say that's indication. Then you can talk to me as a dental technician and maybe modify something sometimes, but mostly 95% of the treatment plan is there already. And in this mock-up finally, because the mock-up will represent also the final work if everything works well. So we have tried in static and in dynamic, as you could see on anterior guidance, so occlusal stability and posterior disclusion of posterior teeth. So we have achieved this kind of result on mock-up we have seen already before, just printing the same mock-up at the level that we have decided to have it. We have increased 3.5 millimeter the occlusion height, so the video, as we have seen before, and automatically have also increased the overjet value, because if you increase the video, automatically, geometrically, you will increase also the video. Sorry, you increase also the overjet, creating more freedom. The patient can move better away the mandible, you can have a less risk to have chipping on the incisal edge. So overjet increase is a very important step. How much we have prepared the teeth for this kind of work? We have used a minimal invasive prosthetic procedure that is a nice, absolutely incredible, nice finalization way in which you can optimize the work that you have started. So that's the initial situation on the left side, and the preparation made on the right side. You see that the preparation are very minimal. We kept 100% of enamel that was present there. We opened some space because we have some little old composite in between, or some maybe brownish area that we want to open just to be sure that there is no decay. So the concept is that to keep as much you can cover the occlusion because you increase the VDO. You can cover also the back side in order to have the chance, with the very light chamfer margin, to have the chance to create an aesthetic appearance together with an occlusal setup. So it will be the combination between aesthetic and function design that we made in this case. We, in this case, maintain the contact point between teeth. Sometimes you can maintain, sometimes you can open it. That is a very classic way how to do it. So it's a combination between occlusion and back side. You see also the clinical picture. We kept 100% of enamel, just having the chance to really cover occlusally to increase the VDO, to sustain, to support the occlusion, but together with that also backally with the buccal veneer that create better aesthetic result. So initial and final tooth reduction, you see that is very minimal preparations, very, very minimal. Just a couple of them, they open it for the reason we said before. There was old composite that had to be redone. And above the buccal occlusal veneers on the lower arch. So that's why the initial, the final, we have changed quite a lot. The length, the incisal edge position, the occlusion. We also increased the length, the visibility of the teeth, of course, with this minimal invasive prosthetic procedure, MIPP. Look at rest position initially, not teeth visible. Delivery, finally, she starts to see teeth. That is a young lady. She needed to improve her aesthetics. Absolutely is a must. And the rest position should show something. Also the progression of the smile. Look, the lingualized position of the initial case and the more buccal position of the final case. The new length, the new color, everything works better. Lateral view of the case. The protrusion, and you see the buccal, the space that is open, of course, on the posterior area. So you have no more contact. So no more interferences on posterior area through the anterior guidance. That is the point. Lateral view, everything seems to be really well integrated from aesthetic, functional, and biological point of view. Some close-up that show you a nice final outcome and a very good, nice integration. And this is 2 years after, with a very good maintenance of the situation. Everything works perfect, and the patient is really happy to have this kind of result. I hope that you enjoy to listen to me. I hope that maybe you can ask you many questions yourself, and maybe we have the chance to stay together once. Of course, I could better explain our philosophy and our, step-by-step procedure that we, of course, are doing in every cases, in every prosthetic rehabilitation, following a kind of guided treatment plan that you have seen already very, very well. Is quite complete. I don't say complex, it's complete. Takes time, but if you do a big rehabilitation, you need to take time. You need to have maybe to spend another 20 minutes to fill up all these kind of values, numbers, and then give to your technician the right way, exactly what he needs to build up a perfect treatment plan, a perfect final outcome, thanks to your perfect treatment plan, because you are guided on that by GetUp. So with that, I would like to thank you for staying with me until now, and see you soon. Bye-bye.